it is fundamental now to gather the data, to assess the data, to use the data to make informed decisions. I want to commend you on the work that you have done and encourage you to continue in terms of the work that needs to be done going forward.
The National Health Research Conference, NHRC, is where science, innovation, and policy meet to impact the health and well-being of the population. This transformative event has been helping to shape Jamaica's healthcare landscape for over a decade. Following its inaugural staging in 2010, it's the flagship platform of the Ministry of Health and Wellness, uniting government institutions, academic minds, and the wider public to share groundbreaking health research that's pushing the boundaries of innovation and that can provide solutions to meet modern healthcare needs. The NHRC's key objectives are to facilitate the sharing of research findings from the various participating researchers, identify operational research with the potential to shape public health policy, and aid special discussions on the conference theme to drive actionable outcomes.
It's research that will have some impact on our operations, our guidelines, our policies. For example, we did COVID research, and that helped shape our COVID response.
Since its inception in 2010, with a gathering of 80 attendees at the Pegasus Hotel in New Kingston, conference attendance has soared over the years.
The last conference would have seen 933 persons on Zoom and over 6,000 persons on social media. So it has grown exponentially.
Early funding support from research partners like the Caribbean Health Research Council and the National Health Fund laid the groundwork for the conference's continued evolution before the Health Ministry took full charge in 2015, ensuring it became a regular fixture on the national health agenda. The National Health Research Conference has seen stunning growth each year in the number and quality of research abstracts submitted.
When we started out, with a few abstracts that would have been submitted up to today, where we have a large volume in terms of poster and oral presentations. The growth still continues to where our numbers have grown, and I'm very proud to be a part of that experience.
Initially, we were getting submissions mainly from the Ministry of Health community, and then we branched out. We're now getting submissions from universities, other universities in Jamaica, as well as Ministry of Health.
The research and the dissemination of research is not the end of it. We use it. Some things may not be ready for use today. There may be plant products that seem to have a good effect on, say, diabetes, but it's early. It's still in rats or other animals. And so it will, over time, probably 5, 10, 15 years down the line, it may prove to be useful. But at least the exposure and to see what is happening in that world is important for us to know.
An example of such research on the control of type 2 diabetes was shared by student researcher at the UWI Faculty of Medical Sciences, Marley Wright.
The results were promising, and it showed that the combination of GSNO and glutathione could be a possible treatment option for type 2 diabetic patients. From the results that I found from my study, it seems promising and something that we could look towards. We could engage the Clinical Translational Research Unit from the Faculty of Medical Sciences at the University of the West Indies, Mona, to see how this could be done. We could also seek further information from them about what other drug tests we need to do to see if we can push this forward to clinical trials.
Some of the key research with strong policy impact looked at road safety and non-communicable diseases, NCDs, and Jamaica's salt consumption pattern.
This was first time we are knowing how we consume salt in Jamaica, and we are consuming just too much salt. Probably almost twice as much salt, sodium. But potassium, which we get from fruits and vegetables, we are not having enough.
The National Health Research Conference awards presenters for high-quality research in 3 categories for both the oral and poster competitions. And these are Best Overall Presentation, the Most Impactful Presentation, and the Best Student Presentation. The NHRC takes months of planning, starting with feedback from participants, debriefing, and an evaluation of the previous event, which helps with choosing the next theme. The theme is then formally approved by the executive management of the portfolio ministry. That is followed by another set of evaluation and meeting, leading to a call for abstracts where researchers are invited to send in their research.
By about summer or mid-year, after we do the call for abstracts, by about September, then we would have our the close of the call. And when that happens, we then do an adjudication. So the abstracts have to be judged to see which will become oral and poster presentations. And then after that, we would contact the researchers and verify that they will present.
Other spokes in the wheel driving the conference are engaged simultaneously as the conference secretariat works administratively with partners, preparing for the opening ceremony, doing supplements and magazines, and then selecting moderators, special presenters, etc.
The systems that have been put in place has grown in strength, and the conference has likewise grown. And so the journey continues, but it has been a good journey.
Till the next conference, every third Wednesday to Friday in November, this has been our peek inside the NHRC, with over a decade of transformative research shaping a healthier future for Jamaica.